like bawufuna udlala utshintsha amateki njenge-presenters
Yeah.
like sometimes it's Awonke, sometimes it's Usiya, and
Sometimes
then it's Lama, then it's
Lwandile. You know, all we do is change and we play games with you. We're magicians actually in the studio.
just like that. Next time it could be you. Do you want to guest present?
Yes.
Email ekse@capetowntv.org or send a short clip of yourself doing your thing. Go Facebook, go Ekse on Cape Town TV to find out more details on how you can participate in this great fun. You can call 021-448-0448. We are Ekse Live. We are proudly Cape Townian. However, we do broadcast to the great nation of South Africa on channel 263 on your DSTV. And we are worldwide on YouTube. Wherever you are, you could be in Atlanta, Georgia, you could be in China, Japan, India. Hey, we're
beginning to sound a little international.
We are. The biggest hit show in this continent. It's Ekse on Cape Town TV on your YouTube channels. Welcome to it, everybody. If you just joined us, do not fear. On Friday between 7 and 8, we do have a repeat of this very episode, so you can tune in to Cape Town TV.
And speaking of education and everything that is about learning and growing bigger and better, today we're going to stick to the topic of tuberculosis, because it's something that is very, very important. As Lwandile Moon mentioned earlier on, we are the third biggest country to have tuberculosis in the world, after China as well as India. So here to talk to us a little bit more about that is the incredible Dr. Becky. So we're going to be finding out more about TB, not just learning about it, but seeing how we can help other people around us deal and live with TB as well. TB is curable though, so if you do want to know more, we will be speaking to Dr. Becky.
It's very alarming when Lwandile, because 1% of the population each year
gets it.
They get TB, and I feel like we are being educated. Maybe we need to do more to educate. Thank you so much, Dr. Becky, for joining the biggest show in the motherland.
Thank you for having me.
Uthathe a busy schedule, Sako, and you think, you know what, I'm going to educate the youth of South Africa. First and foremost, you work in Khayelitsha, and you deal with DRTB patients. How is your job?
My job is challenging, but it's very enjoyable, very rewarding. So MSF, Doctors Without Borders, we've been working in Khayelitsha for many years now, and we work to support patients or people who are living with drug-resistant TB complete their treatment. So we're looking for innovative ways to make that treatment journey a little bit easier. As Goodman explained, the journey is very difficult, and so we look for better ways to access shorter, more tolerable treatments, but also the way that we support the patients to get through that journey.
Yeah, by 1% of a population getting TB each year, what do you mean? What's that number?
So in South Africa, now you're testing me. Within South Africa each year, for drug-resistant TB, there's 11,000 people who are infected. And TB as a whole kills more South Africans than any other condition. So it is something that we should be talking about. It's something that we need to educate ourselves about.
And you say something very important right now. I did not know. I thought maybe a number one killer in South Africa would be HIV, which is what we hear about all the time, would be all these different other things. But one thing I also think people don't recognize is in these big numbers are small children as well. And that's what you are focusing on right now. Pediatrician, where you're dealing with younger kids who have TB. How's that process? What does that look like for young kids?
So children are a very vulnerable group. So as you're growing up, you're still developing your immune system. So children are actually very vulnerable to developing TB. So if there's TB in a household, the younger children are the ones more likely to be infected. So that's the first problem. But from there on, it's always difficult for the child. So we don't have very good tests to diagnose TB in children. So it's much harder as a doctor to actually confirm that the child has TB or not. Once we get to the treatment for children with drug-resistant TB, in Cape Town, it's a very centralized treatment, so that means the child has to move away from their family home to get treatment in a hospital. So they're separated from their caregivers, which has a lot of consequences, as you can imagine. And the treatment itself, which we give to the children, we don't have child-friendly treatment. So, for example, when you go to the pharmacy, you might buy syrup for your baby. For TB treatment, we don't have that. So we use adult tablets, and we crush it and mix it in water. And the taste is very awful for the kids. It's very hard to make them swallow it, and it's very hard to make the medicine up as well. So there's challenges along every step of the journey. So we really now want to focus on finding these children, because we know a lot of these children are never diagnosed with TB. So we want to diagnose them, and we want to get them effective treatment, which is more friendly and tolerable for them.
Speaking of diagnosis, I understand that there's MDR TB and then there's XDR TB. I'm confused. What's the difference?
So essentially, the multi-drug resistant TB, MDR-TB, is when you have resistance to at least 2 of the antibiotics that we use to treat TB. And extremely drug resistant is a resistance to at least 4. So it's basically the number of drugs that you're resistant to.
All right.
Both of them are curable diseases. We now have good treatment in South Africa that is curing more and more patients, but it's still a very difficult, long journey. For both of those conditions. Yeah.
And Goodman had mentioned earlier on that sometimes there aren't any clear ways that you can tell that you do have TB. So are there any other things that we can look at apart from the things that he mentioned? Because he threw up blood, but most people don't get to throw up blood. It's very subtle and can be dormant for quite some time. So how do we know and how to quickly nip it in the bud? Because the quicker we can, the more curable it can be.
Exactly, and that's one of the prevention messages is that the quicker you get diagnosed, the more likely you'll be cured. So don't put off getting tested for TB. So the things really to look out for is a cough that doesn't go away as it usually would, any kind of unexplained weight loss, any fever or any night sweats. And then anything else really non-specific. So coughing up blood is a very important one, although it's quite rare.
You're right.
And in children particularly, children don't behave quite the same as adults. So if your child is not quite right, they're not playing as normal, they're not managing at school, maybe they're not growing well, they're not gaining weight like you would expect them to, or they're not eating well, that could all be a sign of TB as well.
Now, why is this TB taking 2 to 4 years to treat and get well, whereas other types of TBs, 6 months to 9, a couple of months?
So historically, the treatment for MDR or XDR-TB was up to 2 years. Now we're actually able to cure some types of MDR-TB within 9 months. So that just shows how far the treatment has actually advanced. Most people can have an all-oral treatment, so no injections like Goodman had to have. And some can be cured within 9 to 11 months. The reason there's difference to the 6 months for normal TB is just because the number of drugs that are resistant means that we have to add extra treatment to try and cure that condition.
Yeah, you mentioned that the sooner you're diagnosed and get treated, the quicker you can get well. So what are the symptoms of having this type of TB?
So like I said, any prolonged cough, any night sweat, any fever, or any sign of losing weight, go and see your doctor. TB testing is free.
So all the symptoms of TB, whether you have the resistant one or the normal one, is all the same?
It's all the same.
Okay, nothing extra. Okay, so and one thing I wanted to know about as well is how has it been like working in Khayelitsha? How are the cases? Are you finding most people have TB? Because I don't think people wake up and they cough. Most times if you wake up and you cough and your parents are like, oh, just go to school, buy you a cough syrup and that's about it. No one ever says, oh, you might have TB. I'm going to, take care of it right now.
And I think that's why it's really great that we're here talking about this today. And I think we need to talk about TB more often. The more we're educated as a community, the more we can see TB and get treatment quicker. So the cases I see in Khayelitsha, often people have been coughing for quite a long time. So the quicker you get the treatment, is the better for yourself, but also it prevents onward transmission. So TB is spread by coughing. So the longer you cough, the more likely you are to spread the condition to someone else.
Okay, what are Doctors Without Borders calling for? What would you like to see? What change are you aiming for?
So within South Africa now, we're calling for more friendly treatment for children with TB. So we want that treatment to be closer to their home, so they should be able to access it at a primary health care clinic, so they can stay with their loved ones and their caregivers. We're asking for medicine that is friendly for children, that can be swallowed and taste nice, and we're asking for regimens that are short and without any injections.
Yeah, and the treatment is free of charge.
Yes, it's always free. So South Africa is leading the world for that.
Wonderful.
Okay, amazing, amazing. And hearing all these things, are there any stories where you've heard or rather seen people get well from TB, and how? Because most people have a stigma of you're going to be sick and you're going to be sick for a while. And I think most people know that it is indeed curable. You can get better after 6 months or however long it takes. But what are the cases that have made you smile as Dr. Becky say, oh, you know what, we helped that person and they know better now?
We have so many cases like that. I mean, Goodman is a perfect example. Goodman's treatment journey was horrendous, but here he is today. There are many patients like that. We're curing at least 60% of patients with these very resistant forms of TB in South Africa now. And the good news is in children, once they are diagnosed, actually we're curing most of those children once they get onto effective treatment. So don't delay, it's treatable, you will get better, and it puts a smile smile on my face.
Thank you so much, Tata. You just put a smile on
On
my
my
face
face.
as well, because these are good news.
Yes.
Thank you so much for coming through with some good news to Ekse.
Yes, thank you so much. And right now we're going to take a little bit of a short break, so see you after this.
Why are we taking a short break?
Are we not taking a short break?
No, I don't think we
Khayelitsha,
should.
now, what are we taking?
Because I feel like I need to go
We're
register.
leaving. The show flies.
She's been
show
having a hell lot of a
flies.
time.
Remember, Don told you about registering on that platform so that you can be part of the platform.
Satellite.
Yes, if you want to be part of a republic, yeah, extra cool. It's happening on the 28th of December. Are you going to be in Cape Town? If you wish to be part of that excitement, make sure that you register very soon.
Yeah, it's been an amazing show. Sorry for my blonde moment. See, time flies when you're having fun and you're enjoying what you're doing. Don't forget to let us know if you enjoyed the show. We are Ekse_live on Twitter as well as Ekse on Cape Town TV. And don't worry, you can catch the repeat on Friday from the hours of 7 to 8. But I'm going to let you guys speak now.
Oh, I decided to put his leather jacket on. I do not know what is going on.
Helang nina.
Left out, so now
Hey, we'll continue being left out. But before we end, we'd like to thank Dr. Becky. Thank you so much for joining us. Thank you to Dr. Goodman. I kind of thank you to Donovan Goliath.
Yeah,
Thank you
yeah.
to Green Fingers,
Shout out,
for coming through and gracing us with your presence. And of course, to Nangong. So Nangong Song, as we bring you nothing but the best. We are the
Asifiki.
#1
Siyakalalika.
youth show in and around Cape Town.
Yes.
The whole continent, according to Lama, as well as the South African country as well.
Yeah, Eskof.
Yeah, we just happened to based in the mother city. However, we worldwide.
Yeah, because
Thank you guys for tuning in. Follow us on all our social media platforms.
Yeah.
Continue those comments using the hashtag, the one on the screen, side tag.
yeah, this is
That's a wrap, everybody. This
That's
is I almost said a Tuesday afternoon. This is a Wednesday afternoon from us to you. It's all love and enjoy the rest of your Wednesday.
Yes, tomorrow we're talking issues surrounding the public, and then on Friday, go. Make sure that you do return to Susan.
Yo.
Good night. God bless. Up next is Open Studio.
Open studio.